Many women after menopause find themselves waking up at night, walking to the bathroom again and again, feeling tired the next day. This is not just a small problem, it can affect sleep, energy, and even overall health. You might wonder why this happens and what the hidden reasons are. In today's episode of the Senior Podcast, we will explore the top causes of nighttime urination in postmenopausal women and help you understand what might be happening in your own body or in the life of someone you love. Before we move into the main causes, I want to take a moment to remind you why we create this channel. Daily Wellness Focus is here to share clear health information, to support older adults and their families, and to help you feel less alone on this journey. We do not sell products, we do not promote quick fixes. Everything you hear here is only for education and awareness. If you find these videos helpful, please take a second to subscribe, it really means a lot to us. When you subscribe, like, and share, you help this message reach more people, maybe even someone who has been silently struggling. You never know whose night you can make easier, whose health you can protect, or whose life you can touch, simply by sharing. We are building a community where older adults and caregivers can learn, feel supported, and have access to trustworthy information. So, thank you for being here, thank you for listening, and thank you for caring about your health. Now, let's take a gentle step forward and look at the most common causes of nighttime urination in postmenopausal women. Cause 1. Lifestyle and daily habits. When we think about nighttime urination, also called nocturia, the first place we should look is often our daily habits. Many women after menopause do not realize how strongly small choices during the day, especially in the evening, can affect the bladder at night. What you drink, when you drink, and even the kind of activities you do can all play a role. One of the most common reasons for waking up to urinate is drinking too much fluid late in the day. The body naturally slows down at night, and the kidneys filter differently when you sleep. If you drink large amounts of water, tea, coffee, or alcohol in the hours before bed, the bladder fills more quickly, and you may feel an urgent need to wake up. Even something as simple as a few cups of tea in the evening can disrupt your rest. This is because tea and coffee both contain caffeine, which is not only a bladder stimulant but also a mild diuretic, meaning it increases urine production. Alcohol has a similar effect. It reduces the ability of the body to concentrate urine, and it also irritates the bladder lining. Another habit to consider is how evenly you spread fluid intake during the day. Many people forget to drink water earlier, then try to catch up in the late afternoon or evening. This puts more pressure on the bladder at the exact time you want it to rest. A simple change is to drink most of your fluids in the first 2/3 of the day, then reduce the amount as evening approaches. You still stay hydrated, but you avoid overloading the bladder when you go to bed. Food can also play a role. Spicy meals, acidic fruits, or artificial sweeteners can sometimes irritate the bladder and make urgency worse. This does not happen to everyone, but if you notice a pattern, it may help to adjust your diet. Keeping a small journal of what you eat and when you wake at night can reveal surprising connections. Lifestyle is not just about food and drink, it also includes movement and rest. Lack of physical activity can cause fluid to build up in the lower legs during the day. When you lie down at night, this fluid shifts back into circulation and the kidneys create more urine. For some women, simply adding a short walk in the afternoon, or elevating the legs before bedtime, can reduce the number of times they wake to urinate. Stress is another hidden factor. Anxiety or tension can make the bladder more sensitive. After menopause, many women already face sleep difficulties, and stress compounds the problem. Gentle evening routines such as reading, listening to soft music, or practicing slow breathing can calm the nervous system and reduce unnecessary trips to the bathroom. So, what are the practical solutions? First, set a simple rule for fluids. Stay well hydrated in the morning and afternoon, then gradually slow down your drinking as evening arrives. Try to stop large drinks at least 2 to 3 hours before bedtime. If you take medications that act as diuretics, talk with your doctor to see if the timing can be adjusted. Second, watch your caffeine and alcohol. Cutting back in the evening can make a big difference. You might replace a cup of tea or coffee with herbal tea, or try warm water with lemon earlier in the day instead of late at night. Third, move your body. Even light activity like stretching or walking can prevent fluid buildup. If swelling in the legs is a concern, raising them for 15 to 20 minutes before sleep can be very helpful. Finally, nurture your bedtime environment. Keep the room calm, cool, and quiet. Avoid screens close to bedtime and give your body a chance to relax. When stress goes down, the bladder is calmer too. Lifestyle and daily habits may sound simple, but they are powerful. The way you drink, eat, and move each day can decide whether you wake once or many times during the night. By making gentle, steady changes, you support your bladder, protect your sleep, and improve your health in a natural way. Remember, even small steps count, and over time they can add up to big relief. 2. Hormonal changes. After menopause, one of the most significant shifts a woman's body experiences is the drop in estrogen. This hormone has many roles, and one of them is to help maintain the health of the urinary tract. Estrogen keeps the lining of the bladder and the urethra thick, flexible, and well supplied with blood. When estrogen levels fall, these tissues become thinner, more fragile, and more sensitive to irritation. This is one of the key reasons why many women start to experience nighttime urination, urgency, or even small leaks after menopause. Without enough estrogen, the bladder muscles may become less stable. They can contract when they should be relaxed, causing sudden urges to go, even if the bladder is not full. At night, this instability means sleep is interrupted, sometimes multiple times. For many women, this change can feel confusing, especially if they had no bladder problems before menopause. Hormonal changes also influence the way the kidneys handle fluid. Estrogen helps regulate certain hormones that control urine production. When levels drop, the balance can shift, leading to more urine being made at night. This explains why some women suddenly find themselves waking up often, even if their fluid intake has not changed. The thinning of tissues around the urinary tract also increases the risk of urinary tract infections. Infections can make nocturia worse, adding burning, discomfort, and frequent urges. This cycle can be exhausting both physically and emotionally. Sleep is disrupted, energy levels fall, and quality of life suffers. So what can be done? The first step is awareness. Understanding that hormonal changes are a natural part of menopause helps reduce fear and guilt. It is not your fault and you are not alone. Millions of women around the world face the same issue. Medical options are available. Local estrogen therapy, often in the form of creams, tablets, or vaginal rings, can restore some of the lost support to the bladder and urethra. Because these treatments are applied locally, they use very small doses, and they work directly on the tissues that need help. Many women find significant relief with this approach, especially if dryness or irritation is also present. It is important to discuss this with a healthcare provider, as every woman's situation is unique. Beyond estrogen therapy, there are other supportive strategies. Pelvic floor exercises, also called Kegel exercises, strengthen the muscles that support the bladder and urethra. When these muscles are strong, they can counteract some of the instability caused by hormonal changes. Just a few minutes of practice each day can build control and reduce nighttime trips to the bathroom. Lifestyle adjustments also play a role. Avoiding bladder irritants like caffeine, alcohol, and artificial sweeteners can reduce sensitivity. Staying hydrated during the day while limiting fluids at night helps too. Managing stress and maintaining a healthy weight also support hormone balance and bladder health. Another valuable tool is open communication with healthcare providers. Many women hesitate to bring up nocturia or bladder changes, thinking it is just part of aging. But doctors can offer guidance, testing, and treatment options that make a real difference. Sometimes what feels like a hormone issue may be a mix of factors, including other health conditions or medications. Having a full evaluation ensures that the right cause is addressed. It is also important to remember that solutions take time. Hormonal changes develop gradually, and the body needs patience and consistent care. Small steps like practicing pelvic floor exercises, adjusting evening routines, or starting low-dose local estrogen may not transform things overnight, but over weeks and months, the benefits become clear. Hormonal changes are a natural part of life, but they do not have to mean constant nightly interruptions. With awareness, gentle adjustments, and the right medical support, women can regain comfort, protect their sleep, and feel more at ease with their bodies. Sleep is healing, and you deserve to rest deeply even after menopause. Cause 3. Age-related decline in bladder function. As the body grows older, every organ changes, and the bladder is no exception. The bladder is a hollow muscle that stores urine until the right time to release it. In younger years, it can stretch and hold larger amounts of urine without much problem. But with age, the bladder often becomes less elastic, less able to expand, and less efficient at emptying completely. These changes are a natural part of aging, yet they can create real difficulties for sleep and quality of life. One of the most common age-related changes is reduced bladder capacity. Imagine the bladder like a balloon. When it is young it stretches easily, but as it ages the walls stiffen. This means it holds less urine before triggering the urge to go. At night, even a small amount of urine can send a strong signal, waking a woman from her sleep. Another issue is incomplete emptying. Sometimes the bladder muscles weaken with age, and they do not push out all the urine during a bathroom visit. Leftover urine remains, and this makes the bladder fill again more quickly. As a result, the next urge comes sooner, leading to multiple trips at night. The communication between the bladder and the brain also changes over time. The nerves that send signals may become less accurate, creating urgency even when the bladder is not full. For some women, this results in sudden, strong urges that interrupt both day and night. All these changes can add up to frustration. Sleep is broken, energy drops, and daily life feels harder. Women may avoid evening activities or feel anxious about traveling, simply because of the worry about frequent urination. The emotional toll can be just as heavy as the physical one. So, what can be done to help? First, simple lifestyle adjustments matter. Limiting fluids in the hours before bed reduces the load on the bladder. Avoiding caffeine and alcohol is especially important, since both irritate the bladder and increase urine production. These small changes do not solve everything, but they can reduce the number of nightly interruptions. Second, bladder training techniques can be useful. This means gradually teaching the bladder to hold urine for longer periods. By delaying urination just a little over time, the bladder can adapt to a healthier rhythm. It requires patience, but many women find improvement. Pelvic floor exercises are another powerful tool. These exercises strengthen the muscles that support the bladder and help with control. A stronger pelvic floor means the bladder can function more efficiently, and leaks or urgent signals become less disruptive. Just a few minutes of daily practice can bring long-term benefits. Medical support should not be overlooked. If incomplete emptying is a problem, a doctor can perform tests to check how well the bladder is working. In some cases, medications can relax overactive muscles or help the bladder empty more fully. Each woman's situation is different, so guidance from a healthcare provider ensures the right approach. Good sleep hygiene also supports bladder health. Going to bed at a regular time, keeping the bedroom cool and calm, and avoiding late heavy meals can reduce awakenings. Elevating the legs before bedtime may also help move fluid out of the lower body earlier, so the kidneys process it before sleep. It is important to remember that aging is natural, but suffering does not have to be. Even if the bladder cannot work exactly as it did in youth, small steps can restore comfort and confidence. Combining lifestyle changes, simple exercises, and medical advice creates a strong plan for managing nighttime urination. Above all, be gentle with yourself. Many women feel embarrassed about these changes, but there is nothing to be ashamed of. Your body has carried you through decades of life, and with care, it can continue to support you. Sleep is precious and you deserve rest. By understanding how age affects the bladder, and by taking practical steps, you can reduce nighttime trips, wake with more energy, and feel more at peace in your daily life. Cause 4. Overactive bladder. Overactive bladder, often called OAB, is a condition where the bladder muscles contract too often or at the wrong time. For many women after menopause, this becomes a major reason for nighttime urination. Even when the bladder is not full, sudden signals urge you to go, and sleep is interrupted again and again. It is one of the most frustrating causes of nocturia because it feels unpredictable, and it can affect daily life as well. OAB happens when the communication between the bladder and the brain is disrupted. Normally, the bladder fills slowly, stretches, and sends a message to the brain only when it is near capacity. But in OAB, the bladder sends early, urgent messages, and the muscles tighten when they should stay relaxed. This leads to frequent trips to the bathroom, both during the day and at night. For women after menopause, hormonal changes, weaker pelvic muscles, and age-related nerve changes all increase the risk of OAB. Sometimes it develops gradually, other times it appears suddenly. The main symptoms are urgency, frequency, and nocturia, and sometimes small leaks if the bathroom cannot be reached in time. The emotional impact of OAB can be heavy. Women may feel anxious in public, avoid long trips, or lose confidence in social situations. At night, waking several times for urgent trips reduces deep sleep, leaving fatigue and irritability during the day. The cycle of poor sleep and bladder urgency can feel overwhelming. But there are solutions, and many women find real relief. The first step is lifestyle adjustment. Avoiding bladder irritants like caffeine, alcohol, artificial sweeteners, and acidic foods reduces unnecessary stimulation. Drinking smaller amounts throughout the day, rather than large drinks at once, helps keep the bladder calmer. In the evening, reducing fluids 2 to 3 hours before bedtime is especially useful. Bladder training is another effective method. This involves gradually delaying urination by small amounts of time, teaching the bladder to hold more before sending the signal to go. It takes patience and consistency, but with practice the bladder becomes less reactive. Keeping a bladder diary, noting times of urination and fluid intake, can guide this process. Pelvic floor exercises, or Kegels, are also powerful tools against OAB. Stronger pelvic muscles give better control over sudden urges. These exercises are simple, take only minutes each day, and over time they reduce both urgency and leakage. Many women underestimate how much pelvic training can help, but research shows real improvement with consistent effort. Medical options are available as well. Doctors may prescribe medications that relax bladder muscles, reducing unwanted contractions. These medicines can be very effective, though they sometimes cause side effects like dry mouth or constipation. Newer treatments, such as nerve stimulation therapies, can also help by restoring better communication between bladder and brain. Each woman's situation is unique, so medical guidance ensures the safest and most effective plan. Behavioral strategies support these treatments. Scheduling bathroom visits, instead of waiting for the urge, can help the bladder follow a steadier pattern. Managing weight, staying active, and reducing stress all improve bladder health. Stress management is especially important, because anxiety often worsens bladder urgency. Gentle relaxation practices before bed, like deep breathing or light stretching, calm both mind and bladder. It is also important to stay positive. OAB is common, but it does not define you. Many women feel embarrassed or think they must accept it as part of aging, but that is not true. With knowledge, simple changes, and support, the bladder can be managed and life can feel normal again. At night, every trip to the bathroom may feel like a reminder of loss, but it is really a signal to listen to your body. By addressing OAB directly, you give yourself the chance to sleep more peacefully, regain energy, and live with greater freedom. You deserve rest, confidence, and comfort, and with the right steps, OAB can become only a small part of your life, not the center of it. Cause 5. Other medical conditions. Nighttime urination in postmenopausal women is not always just about hormones, aging, or bladder changes. Sometimes, it is linked to other medical conditions that place extra stress on the body. These conditions may not begin in the bladder, yet they influence how the kidneys and bladder work, creating more urine at night or making urgency worse. Understanding these connections is important, because treating the underlying health issue often improves nocturia too. One of the most common conditions is diabetes. When blood sugar is poorly controlled, the kidneys try to remove the excess sugar by producing more urine. This process, called osmotic diuresis, can cause frequent urination both day and night. Many women with diabetes notice that nocturia becomes worse when their sugar levels are high. The good news is that improving glucose control through diet, exercise, and medication often reduces the nighttime trips. High blood pressure is another factor. Many women take medications called diuretics to manage hypertension. These drugs help the body remove extra fluid, which lowers blood pressure, but they also increase urine production. If taken late in the day, they can fill the bladder at night. Adjusting the timing of medication under medical guidance can reduce this effect without losing the health benefit. Heart failure and kidney disease also contribute to nocturia. In heart failure, fluid can build up in the legs during the day. When a woman lies down at night, this fluid shifts back into circulation, and the kidneys remove it as urine. The same happens when kidney function changes, leading to less efficient fluid handling. For these women, elevating the legs in the afternoon, reducing salt intake, and following medical advice can make a real difference. Sleep apnea is another hidden cause. This condition, where breathing stops and starts during sleep, changes hormone balance and increases urine production. Many women do not realize that waking to urinate is partly triggered by disturbed breathing. Treating sleep apnea with lifestyle changes, breathing devices, or other medical therapies often reduces nocturia dramatically. Urinary tract infections also cannot be ignored. Infections cause irritation, urgency, burning, and frequent urination, especially at night. After menopause, the risk of infection rises because estrogen levels are lower and the protective lining of the urinary tract is thinner. If infections are frequent, a doctor may suggest local estrogen therapy, hydration strategies, or preventive measures to keep bacteria under control. Managing these medical conditions is not just about reducing trips to the bathroom, it is about overall health. Good diabetes control prevents complications, blood pressure management protects the heart and brain, and kidney care preserves energy and balance. Every step that supports these systems also protects sleep. So, what practical steps can women take? First, regular medical checkups are essential. Many women think nocturia is simply aging, but sometimes it is the body signaling a deeper issue. Blood tests, urine tests, and simple examinations can reveal diabetes, kidney problems, or heart concerns early. Second, communication with healthcare providers is key. If you notice nighttime urination increasing, bring it up even if it feels embarrassing. Doctors expect these conversations, and solutions often begin with small adjustments. A change in medication timing, better blood sugar monitoring, or a sleep study for suspected apnea can transform sleep quality. Third, support your body with lifestyle care. Eat balanced meals, stay active, manage weight, and avoid too much salt or sugar. These habits not only improve chronic conditions but also calm the bladder. Gentle routines like raising your legs before bedtime or practicing relaxation breathing can also help fluid balance and reduce stress on the bladder. Most importantly, remember you are not alone. Millions of women after menopause deal with nocturia connected to other health issues. It can feel frustrating, but it is also a chance to take control of your health in a bigger way. By addressing diabetes, blood pressure, heart health, kidney care, or sleep apnea, you are protecting your whole body, not just your bladder. Nighttime urination is often a symptom, not the disease itself. When the underlying condition is managed, sleep improves, energy returns, and life feels lighter. Each step toward balance, whether through medical care, daily choices, or emotional support, helps you reclaim the rest you deserve. Aging may bring challenges, but with awareness and action, you can meet them with strength and hope. 6. Medications. Nighttime urination in postmenopausal women can sometimes be traced back to medications. While these drugs are prescribed to protect health, they may unintentionally place extra pressure on the bladder at night. Understanding how medications influence fluid balance, kidney function, and bladder activity helps women and their doctors find solutions that improve sleep without sacrificing treatment goals. One of the most common examples is diuretics, often used for high blood pressure or heart failure. Diuretics, sometimes called water pills, help the body remove extra salt and fluid. This process lowers blood pressure and reduces swelling, but it also increases urine output. If a woman takes her diuretic late in the day, the bladder continues to fill during the night, leading to more bathroom trips. A simple change, such as taking the pill earlier in the afternoon, often reduces this problem while keeping blood pressure under control. Other medications also play a role. Certain antidepressants can affect bladder muscle function, either by relaxing it too much or by creating urgency. Some sedatives and sleeping pills reduce the brain's ability to sense a full bladder, so women may wake with strong urgency at night. Medications that contain caffeine, sometimes used in pain relievers or stimulants, also increase urine production and irritate the bladder lining, which can trigger nocturia. Corticosteroids, used to reduce inflammation in conditions like arthritis or asthma, may raise blood sugar or fluid retention, which indirectly increases urination. Calcium channel blockers, another class of blood pressure drugs, can relax bladder muscles and create incomplete emptying, leading to more nighttime urgency. Even over-the-counter remedies such as herbal supplements or decongestants sometimes irritate the bladder or alter urine production. What makes this situation challenging is that medications are often essential. A woman cannot simply stop taking her heart medicine, antidepressant, or asthma treatment. This is why communication with healthcare providers is so important. Doctors understand these side effects, and small adjustments often help. For example, switching the time of day a pill is taken, lowering the dose, or choosing an alternative medication may ease nocturia without losing the benefit of treatment. It is also helpful to keep a bladder diary. By writing down when medications are taken, when fluids are consumed, and when urination happens, patterns become clear. If a woman notices that nocturia worsens after a certain pill, she can share this with her doctor. Having detailed information makes the conversation more productive, and it helps doctors pinpoint which medication may be contributing most. Lifestyle choices can also reduce the impact of medication on the bladder. Drinking plenty of water early in the day, but limiting fluids a few hours before bed helps. Avoiding alcohol and caffeine, which add to bladder irritation, is another smart step. Gentle evening routines such as elevating the legs to reduce swelling can shift fluid balance before bedtime, lessening the nighttime load on the bladder. Emotional support matters too. Many women feel frustrated when their medications, which are meant to protect health, interfere with sleep. This frustration can create stress, and stress itself worsens bladder urgency. By talking openly with doctors, pharmacists, or support groups, women gain reassurance that they are not alone. Often, the solution is a combination of medical adjustment and self-care, not a complete change in treatment. Another helpful tool is medication review. Once or twice a year, it is wise to sit down with a doctor or pharmacist to review every prescription, over-the-counter drug, and supplement. Sometimes, medications are no longer needed, or newer alternatives exist with fewer urinary side effects. This process not only helps reduce nocturia, but also prevents drug interactions and improves overall safety. The most important message is balance. Medications save lives, protect the heart, regulate mood, and fight disease. Yet, side effects like nocturia remind us that the body is interconnected. With careful planning, it is possible to keep the benefits of treatment while reducing the burden of nighttime urination. If you are experiencing nocturia and you take daily medications, do not ignore the connection. Bring it up at your next appointment. Doctors appreciate when patients are proactive, and small changes can make a big difference. Sleep is not a luxury, it is part of healing. By finding the right balance between treatment and comfort, you can protect your health and reclaim the rest you deserve. 7. Sleep disorders. Sleep disorders are often overlooked when women think about nighttime urination. Many assume that waking up to use the bathroom means the bladder is the main problem. In reality, sleep itself may be the root cause. If the brain is not reaching deep, restorative sleep, the body becomes more sensitive to small signals such as a partially full bladder. Sleep disruptions can trick a woman into believing she woke up to urinate, when in fact the sleep problem came first. One of the most common conditions is sleep apnea. In sleep apnea, breathing repeatedly stops and starts during the night. Each pause in breathing places stress on the body, raising blood pressure and changing hormone levels. The kidneys respond by making more urine, especially at night. Women with untreated sleep apnea often notice frequent trips to the bathroom, sometimes every 2 hours, even if they reduced fluid intake before bed. The good news is that treating sleep apnea with continuous positive airway pressure, CPAP, therapy or other methods not only protects the heart and brain, but also reduces nocturia. Insomnia is another sleep disorder closely linked to nighttime urination. Women with insomnia often wake multiple times during the night, and once awake they feel the urge to urinate. This urge may not be strong, but it becomes a habit. Over time, the brain connects waking with going to the bathroom, reinforcing the cycle. Relaxation training, cognitive behavioral therapy for insomnia, and gentle sleep hygiene practices can help break this pattern. Restless leg syndrome can also interfere with sleep. This condition creates an uncomfortable urge to move the legs, especially at night. The constant movement makes sleep shallow and fragmented. Because the body never reaches deep rest, women wake often and use the bathroom more, even if the bladder is not the true cause. Treatments for restless legs, including medication, iron supplements, or lifestyle adjustments, can restore sleep and ease nocturia. Fragmented sleep in general, whether from stress, pain, or an irregular schedule, can heighten bladder awareness. When the nervous system is on alert, the bladder sends stronger signals. Something that would not wake a person during deep sleep can become a loud alarm in light sleep. This is why improving sleep quality, not only bladder health, is key. The path forward often begins with an honest conversation about sleep. Many women do not bring up snoring, insomnia, or restless nights with their doctor, focusing only on the bladder. Yet, addressing sleep problems can reduce nighttime urination more effectively than bladder medications alone. A sleep study, either at home or in a clinic, may uncover hidden issues such as sleep apnea. Practical steps can also improve sleep and reduce nocturia. Keeping a consistent bedtime, limiting screen use before bed, and creating a calm sleeping environment are powerful tools. Gentle evening routines such as stretching, reading, or listening to soft music tell the body it is time to rest. Avoiding caffeine, heavy meals, and alcohol late in the day also protects sleep. For women who nap during the afternoon, keeping naps short and earlier in the day may prevent nighttime disruptions. Stress management is equally important. Anxiety and worry activate the nervous system, making it harder to fall asleep and stay asleep. Techniques such as deep breathing, mindfulness meditation, or journaling can calm the mind before bedtime. Sometimes, counseling or therapy helps women address deeper sources of stress, breaking the cycle of sleeplessness and nocturia. Family members can play a supportive role. If a partner notices loud snoring, gasping, or restless movement, sharing this information with the doctor is valuable. Sleep disorders often go unnoticed by the individual but are obvious to those nearby. Addressing these clues leads to better diagnosis and treatment. For women struggling with both sleep problems and nocturia, the key is not to separate the two. The bladder and the brain are connected. When the brain is restless, the bladder feels restless too. By treating sleep disorders, the nights become calmer, and trips to the bathroom decrease naturally. The message is hopeful. Sleep disorders are treatable and solutions exist. With medical support, lifestyle changes, and a compassionate approach, women can enjoy deeper sleep and fewer nighttime interruptions. Rest is not only about comfort, it is about healing. By caring for sleep as much as bladder health, women protect their energy, mood, and overall well-being. We have talked about many possible reasons why older adults wake up at night to urinate. Each cause is different, yet they all share one truth. Nighttime urination is not only about the bladder, it is about the whole body. Aging changes, hormones, medical conditions, medications, sleep quality, and daily habits all play a part. By understanding these factors, we can approach the problem with care, not fear. What we share here does not replace medical advice, but it can open the door. It can help you notice patterns, prepare better questions for your doctor, and feel less alone. Many seniors think they are the only ones waking up at night, yet millions share the same struggle. You are not weak, you are not failing, you are simply experiencing a challenge that comes with age and health. The path forward is not one size fits all. Some people improve by adjusting evening habits, others need to review medications, and some require treatment for sleep disorders or chronic illness. Each step is progress, even small ones matter. The goal is not perfection, the goal is better rest, more comfort, and more energy for the day. We hope you felt warmth and reassurance in this video. If you take one message away, let it be this. Waking up at night is common, but it is not something you must silently accept. There are answers, there is support, and there is hope. By learning and caring for your body, you can improve your nights, and that means brighter days too. Thank you for spending time with us. We value your trust, and we are honored to walk with you on this journey. Remember, this is about knowledge, not products, not promotion. It is about sharing, caring, and helping each other find peace and sleep again. Thank you for spending your time with us today. We hope this video gave you clarity, comfort, and a sense of support. Nighttime urination can feel tiring and frustrating, yet you are not alone, and there are always steps you can take to feel better. If you found this video helpful, please give it a like, it helps others find this information too. Share it with friends or family who may face the same issue. Sometimes just knowing they are not alone can make a big difference. And if you want more warm, science-based guidance for seniors and caregivers, please subscribe to our channel, Daily Wellness Focus. Each week we share simple, trustworthy insights that can bring ease and strength to your daily life. We also invite you to join the conversation. Have you or your loved one struggled with waking up at night to pee? What strategies or changes have helped you? Leave a comment below. Your story may inspire someone else who is looking for answers. Take care of yourself, rest well, and remember, every small step toward better sleep is a step toward a brighter tomorrow.